Hello, I'm Dr. Robert Ratner, the Chief Medical Officer here at Virta Health, and it's a pleasure to participate in this Moonshot effort. I've been dealing with diabetes now for 40 years, and all I've seen is the progressive increase in its incidence and its prevalence. That's why we believe the imperative to reverse diabetes is truly a moonshot. If you look at the trends within the United States, we just see this continuous rise in diabetes. Undiagnosed diabetes remains a major problem, but total diabetes continues to go up. We're now at approximately 13% of the US population as a whole that are affected by diabetes. But in fact, it's even getting worse. A recent report looking at the Today trial from the NIH showed that type 2 diabetes in youth has actually doubled in the last 5 to 10 years. So we're now seeing diabetes at a younger age, and we're seeing it for a longer period of time. Now, when I was originally in my training, we talked about the diabetes belt in the South. And you can see in 2004 where there was really a focus of diabetes through the South and the Mid-Atlantic range. And the West was really pretty much spared. Today, that's no longer the case. It's difficult to find any county in the United States with less than 5% prevalence of diabetes. And now we're finding lots of counties where the prevalence of diabetes is upwards of 25 to 30%. This becomes a major problem. There is simply no way we can sustain this. Recently, the US Preventive Services Task Force revised their recommendations for screening for diabetes, screening for prediabetes, and the necessity to refer these individuals for therapy. These were all driven by the increased incidence of diabetes and with diabetes occurring at a younger age, as we just demonstrated. It's critically important now that we identify individuals who have prediabetes because we have known therapies to prevent the progression. We need to identify diabetes as early as possible to minimize the risk of complications. We know that we can treat people with diabetes to reduce the risk of eye disease, kidney disease, nerve disease, and now even cardiovascular disease and stroke. So following these new recommendations, initiating screening in adults over the age of 35 and starting even earlier in those who are high risk becomes critically important in order to get them into a program of therapy. Now, why is it so important, number one, to identify individuals with diabetes and then to aggressively treat them? That's really come to the fore just recently in the COVID-19 pandemic. We have seen people with diabetes disproportionately affected by the COVID-19 virus. The CDC reports that upwards of 40% of all of the COVID-19 deaths have occurred in people with diabetes. We know the relationship between glucose and the need for hospitalization and the relationship with mortality within COVID-19. Individuals admitted to the hospital with glucose levels greater than 180 have an 11-fold increased risk of mortality as compared to those who come in with glucose levels of less than 180. Now, within the Virta family, we've been very interested to see whether or not our patients have had the same sort of complications related to COVID. And we've been very reassured. Nevertheless, 340 of our patients have been affected by COVID after they joined the Virta family. We've been very, very relieved to see that 89% of these were able to be taken care of at home. Only 11%, 38 individuals, required hospitalization. And of those, only 6 required breathing help, or required hospitalization in the ICU. And only one patient out of 340 succumbed to COVID-19. So that we believe that the rapid reduction in glucose and the weight loss associated with the Virta intervention clearly is having an acute beneficial effect on those individuals with diabetes who are unfortunate enough to become infected with the COVID-19 virus. Now, the heart of Virta is really the idea of changing the natural history of diabetes. This cartoon shows the typical traditional diabetes natural history with a progression of hyperglycemia, the need for more and more medications, progressive weight gain, and complications. What are we talking about when we say diabetes reversal? Diabetes reversal is a process. It's an intervention that leads to normalization of glucose without the need for medication. Recently, we've seen an international consensus on defining diabetes remission. They agree with Virta that reversal is the process by which you get there, and that remission should be defined as normalization of glucose with deprescription of glucose-lowering medication that occurs at least 3 months after deprescription and at least 6 months after the initiation of lifestyle. We at Virta are committed to this model of increasing the number of people who can achieve diabetes remission. That's really the critical point here. How can we do that? Well, these data from our controlled clinical trial demonstrates the population effect after 1 year. At baseline, you see a broad representation of hemoglobin A1Cs, with 40%, actually 50% being clearly out of control. At 1 year, we now have brought hemoglobin A1C levels down below the threshold for diagnosis of diabetes in 72%. And of this 72%, the majority actually came off of their diabetes medications as well. So we believe that the intervention can, in fact, take us on the road to diabetes reversal and ultimately achieve diabetes remission. What about longer-term outcomes? We've continued this control trial to 2 years. We see a sustained fall in hemoglobin A1C, a sustained reduction in body weight of 12%. We see anti-inflammatory effects. We see blood pressure beneficial effects. We see lipid beneficial effects. And we see the disappearance of liver fat and decrease in fibrosis scores in almost 3/4 of our patients. We are affecting overall metabolic health in a beneficial way, and that becomes very important. But with any medical intervention, it needs to be sustainable. We now have data at 3.5 years from our clinical trial that was presented at the Endocrine Society a year and a half ago. And we've just completed our assessment at 5 years for this cohort as well. I don't have the data for the 5-year cohort yet. We're analyzing it now. But what you can see is the sustainability in both hemoglobin A1C reduction and in diabetes medication deprescription out to 3.5 years. The usual care control group was only continued for 2 years as the study was designed. And we felt it unethical to continue that control group for the subsequent 3 years. So we're seeing a pandemic, not only of COVID-19, but a pandemic of diabetes that's integrated with it. We need to be able to prevent diabetes in the future and reverse diabetes in those who have it today, Otherwise, the economic costs and the human costs are going to be intolerable. We must reverse diabetes, or else we'll be consumed by it. Thank you so much for your attention. It's now my pleasure to introduce Amit Shah, the Chief Operating Officer here at Virta Health, to talk to you about the economic analyses and the impact that Virta has on healthcare costs. Amit?
Thank you, Dr. Ratner. I'm excited to be here today to share new insights that we've developed at Virta. The fact that a disease as prevalent and devastating as diabetes is reversible is worth celebrating. But in order to end the war on diabetes, clinical effectiveness is not enough on its own. A treatment also needs to be cost-effective so that it can achieve widespread adoption and help the people who need it the most. Today, I'm excited to announce that Virta has performed a claims analysis that, using a Milliman-validated methodology, proves $425 gross savings per participant per month over 2 years. As Dr. Ratner's presentation just highlighted, Virta has rigorously studied and published clinical data to reinforce the value that our treatment can bring to patients' health. We applied a similar level of rigor to our financial analysis in order to prove that offering a diabetes reversal treatment like Virta is not only the right thing to do for patients, but also a financially responsible decision for a business. For our analysis, we looked at the real-world claims data for 3 large employer customers. We worked with our partners to have patient, medical, and pharmacy claims data spanning over 3 years. And we included nearly 6,000 patients with type 2 diabetes, both those that were on the Virta treatment and those that were not. Overall, we analyzed nearly 125,000 patient member months. Using data from these 3 customers from different industries also allowed us to look at patients from very diverse geographies and backgrounds. The patients in our dataset came from 30 different states and had an age ranging from 31 to 70. We also employed several measures to ensure that our analysis complied with the industry-accepted best practices and sought the experts at Milliman, a leading actuarial firm, to validate our methodology. We started with 2 groups, one that received the Virta treatment and a reference group that did not. Our reference group came from the same customer groups over the same time period, representing people that had the exact same plan design and treatment options, which really minimized the differences due to any external factors. We used a difference in differences methodology, which is the gold standard for a study like this. We ensured that the 2 populations are comparable and then calculated the average difference in changes in claims cost for the 2 groups across 2 years. Over 2 years, our analysis demonstrated a $425 gross savings per patient per month, resulting in savings of more than $10,000 per patient. Going a little deeper into these results, about 50% of the savings come from elimination of expensive medications, which is exactly what Virta is uniquely designed to do. We're also producing savings from decreased utilization of other services, fewer complications, and elimination of other medical expenses. As you may recall, Virta puts 100% of our fees at risk for meeting industry-leading clinical outcomes goals. If you think about these savings in conjunction with Virta's unique business model, the Virta treatment is a low-risk and cost-saving measure for any business. This is welcome relief as health costs continue to rise and budgets get increasingly tight. Let's not lose sight of what this means for patients. Patients certainly can see savings from reduced medication spend, but more importantly, they will see the great clinical and quality of life benefits that Dr. Ratner just shared. Here's a snapshot of the 2-year clinical outcomes data from the 3 customer populations across their entire patient population, not just a subset of patients analyzed in the study. Overall, these patients saw on average a 1-point reduction in estimated A1C, over 7% weight loss, and over 55% of type 2 diabetes medications eliminated. Nearly 50% of these patients also completely eliminated all of their type 2 diabetes medications. These results mark a huge win for all of us in the war against type 2 diabetes. Not only can we meaningfully impact health outcomes for patients living with this disease, we can do so in a way that makes it an easy and financially responsible decision for payers and patients alike. Thank you.